Hello and welcome back to Unacademy. So let's get NEET PG. Myself, Dr. Muskan Chaudhary, and we'll do the question answers for the trematodes in today's sessions. And if we completed that within time, we'll do the question answers for Cestodes as well and revise that. So starting with Unacademy, we can access both the live and the recorded sessions on the plus subscriptions, learning from the India's topmost educator for any medical examination, competing in the T&Ds and studying on the device of a choice and assessing up to 25,000 of the MCQs with printed and the digital notes. Diagonal subscription, Unacademy and the Prep Ladder has come together for the clinical essentials, video lecture QBanks, rapid revision, live batches, QBanks, and the T&Ds. For the plus, it is for 2 years, it is around 36,000 rupees, and for Iconic, it is around 58,500, costing us around 2438 and 1,500 per month. And please do use my code, that is Muskan 10. With updated, highly effective Q banks based on latest examination pattern and detailed explanation. Special class features includes the interactive live classes. We can do the polling for the learners, talking to our educators in the live sessions, and never miss a class because we'll get the notification for the same. Download the lecture notes and that to attend the classes anytime and anywhere. Target PG batches for the 3 months with best of the batch and the modules, GTs, PYQs, and the PDF notes with practice questions with focus FMG batches with best of the batches with all the 19 subjects, FMG GTs, live interactive classes, PDF notes, and with 24 month subscription, 4 month is totally free, with 12 month, 2 month is free, and with 6 month, 1 month is free. Okay, so we'll start with the question answers round now. Yes. So starting with the first question, a 15-year-old complains of the loose motion, intermittent abdominal pain of 1 year. Wet amount of stool shows multiple ova that is more than 100 microns in the length. Which of the following agent is responsible? That is the fasciola gigantica or gastrodiscoids hominis or it is the ankylostoma caninum or the opisthoticus viverni. Yes. So, talking about the answers now, amongst the of all of the following, the eggs of the facial gigantica, name itself the gigantica, the ova that is the eggs are more than that of the 100 micrometer in the size, and the facial gigantica is associated with that of the fever and the abdominal symptoms. Now, eggs are what bile stained and the unemerald eggs and the operculated eggs that are found, and the acute disease representing with that of the infective form, that is the metacercaria, because it is what trematodes, metacercaria, that is the infective form and resulting into the fever and the upper quadrant pain. Hepatomegaly. Now comes the next option, that is the gastrodiscoids hominis. Now gastrodiscoids hominis, here also the eggs are although operculated. but the size is what? Size is around 150 micrometer, and the infections is generally what? Asymptomatic. Coming to the ankylostoma caninum, the ankylostoma, it is mainly responsible for the cutaneous larva migrans. Plus, eggs are not found in the humans. It is found in the feces of the canine animals. Opisthoticus viverni, that is having the flask-shaped egg. If you remember, that is a flask-shaped operculated egg with the no. Water host is required for cystosomiasis, fish, cyclops, snails, or the crab. Yes, the water hose that is required for cystosomiasis. Now, cystosomiasis is having only one host and one intermediate host, that is the water hose that is required is what? The snail, and it is what the infective form is the cercaria, and it is by the skin penetration by the cercaria. True about the trematodes is that three host is required, segmented anus is present, and body cavity is present. So, which of the following statement is true? Yes. Now coming to the answer, now true statement is three host is required. This is true because one definitive host, that is generally the man, and that and two intermediate hosts depending upon the trematodes we are talking about. The first intermediate host is snail, and depends second intermediate host is whether the aquatic plant or the fish or the crab. It is segmented. Now talking about the trematodes. Trematodes, they are what? The leaf-like. Trematodes, what they are leaf-like, and they are what? They are unsegmented. They are what? Unsegmented. Alright, so they are not segmented, talking about the anus that is present. Now, alimentary canal is present, but that is not complete. That is, they have the incomplete alimentary canal with no anus. And body cavity is absent. Body cavity is present in case of the nematodes. Alright, so only first statement is true. Which organism can be isolated from the stool and the sputum? That is the Paragonimus, Fasciola, Chlororhynchus, or the Carinae. Yes, so which organism can be isolated with a stool and the sputum? What is the other name for the Paragonimus westermani? That is the oriental lung fluke. What is the other name for the fasciola? That is the sheep liver fluke or the intestinal fluke, depending on the fasciola hepatica or the busky. Then we have the Chloroncus. What is the other name? That is the Chinese liver fluke or the oriental liver fluke. Now, Paragonimus that is infecting the mainly the right lobe of the lung, and it can be isolated from the stool as well as the sputum. Cercaria are the infective form of Histosoma hematobium, Paragonimus westermani, Fasciola hepatica, or the Taenia solium. Yes, what is the correct answer? Cercaria are the infective form. We've already discussed that for all the trematodes, what is the infective form? The infective form is the metacercaria, but we have the exception that is the cystosoma, where it is a, as far as we remember, that is the cercaria is the infective form, and it is by the skin penetration. It is also the exception because all the trematodes that is having the operculated eggs, that is the diagnostic form, but here also exception that is a non-operculated eggs. All right. And what is the infective form? That is a Cercaria, and here two hosts is there. One is the definitive host, one is the intermediate host. By all the trematodes, they have the total three hosts. One is the definitive, and two are the intermediate host. Then we have the Cystosoma hematobium, Mansoni, and the Japonica. Hematobium that is having the terminal spine, Monsoni that is having the lateral spine, and rudimentary spine in the Japonica. What was the site that was involved? The vesicle and the pelvic venous plexus. Here, inferior mesenteric vein and the superior mesenteric vein. That is the cystosoma hematobium. That is the cercaria is the infective form. Now, a man after return from complaints of the pain in the abdomen, jaundice, and the increased alkaline phosphatase with the conjugated hyperbilirubinemia, USG shows the blockage of the biliary tree. What could be the cause? That is a fasciola busci, strongyloids, Chloroncus sinensis, or Ganestostoma spinigerum. Yes, what is the correct answer? Now, talking about the symptoms, that is a pain in abdomen with the jaundice and the increased alkaline phosphatase, and USG showing the blockage of the biliary duct, biliary tree. Now, this is very important where we're getting the biliary duct obstructions and the USG showing the blockage of the biliary tree, because symptoms like the pain in the abdomen, jaundice, and all, but specifically giving the blockage of the biliary tree, this is seen in the Chloroncus sinensis. Now, talking about the symptoms about the Chloroncus sinensis, we remembered C4C, that is the Chinese liver fluke, Although fasciola, it is given the fasciola busci, not the fasciola hepatica. Fasciola hepatica is the liver fluke, and the fasciola buscae is the intestinal fluke. The liver symptoms that are mainly seen in the fasciola hepatica, not in the buscae. So this rules out the fasciola buscae. Now, Chloronarcus sinuses, that is also known as the Chinese liver fluke or the Oriental liver fluke, and it has the low warm burden, generally asymptomatic, but if presents with the symptoms, then it is responsible for the C4C, that is the cholangitis, very important one, that is the cholangiocarcinoma and the biliary obstructions. Now, a 7-year-old presented with the intermittent abdominal cramps, loose stools, and on stool examination, egg of the size that is 100 micron are seen, which is not the cause, that is a facial giganticum, echinostoma, iliocanum, or the gastrodiscoids hominis, or the Opisthorchis viverni. Now, the symptoms that are given are generalized symptoms with abdominal cramps, loose stools. This can keep present in all of the trematodes, but how to identify is on the basis of the size of the egg. Now, the name itself, that is a fasciola giganticum, that is the size is around 150 micron. Then we have the echinostoma, that the size is around 90 micron. Then we have gastrodiscoids hominis, that is having the size around again 150, but Opisthorchis, that is having the small egg size, and that is around only 11 to 10 to that of the 30 micron. So that is the smallest egg size, that is the Opisthorchis viverni. Parasites that is causing the lung infestations are the H. nana, Paragonimus westermani, Tinea saginata, Echinococcus granulosus, or the multilocularis. Again, more than one option can be true for this one. Yes, so parasites causing the lung infestation. Now, what is other name for the Paragonimus westermani? That is the Oriental lung fluke. That is having the lung infestation apart from this Echinococcus granulosus. Now, multilocular that does shows the multiple locules, which is mimicking the malignant condition. But what is the main site that is involved is the liver, not the lung. What are the parasites now that is showing the lung infestations? We have a list. One is the Paragonimus westermani, that is the Oriental lung fluke. Other than this, we have the Ascaris, hookworm, hookworm larval, and what else? Strongyloids and amoeba histolytica. Cholangiocarcinoma is caused by the fasciola infestation, Cloacus infestation, Paragonimus infestation, or the Scaris infestation, or none of these. Yes, what will be the answer? So cholangiocarcinoma, that is, remember C4C, that is the Chloranthes sinensis, that is the Chinese liver fluke or the oriental liver fluke responsible for causing the cholangitis, biliary tree obstruction, and the cholangiocarcinoma. That is the Chloranthes. What is the definitive host? That was the man. And what is the first intermediate host? That was the snail. And what was the second intermediate host? That was the fish or the crab. Now we have the list of the trematodes and that is associated with the other malignancies. Talking first about the cystosoma that is responsible for the cystosoma that is by the skin penetration and the infective form was Cercaria and responsible for the squamous cell carcinoma of the urinary bladder. Alright, next we have is the Chlornarcus sinensis. What is the association of the cancer that is the cholangiocarcinoma of the liver, bile duct and the adenocarcinoma of the pancreas. Then we have the next one that is the Opisthochus sinensis, Opisthochus viverni that is also associated with the cholangiocarcinoma of the bile duct. That is cystosoma, squamous cell carcinoma of the urinary bladder, and the Chlorunchus carcinoma and adenocarcinoma of the pancreas. Opisthochus that is also associated with the cholangiocarcinoma of the bile duct. Pancreatic carcinoma is caused by the fasciola, Chlorunchus paragonimus, or none. We just discussed that is the adenocarcinoma. Adenocarcinoma of the pancreas is caused by the Chlornorchis. Now, which is not a liver fluke, that is the Paragonimus, Chlorunchus sinensis, Genethostoma, Spinigerum, Opisthochus, or the whipworm. Yes, so which is not a liver fluke. Now, Paragonimus, that is the oriental lung fluke. It is not a liver fluke. Then we have the Chlorunchus, that is the Sifusi, that was the Chinese liver fluke. So this is a liver fluke. Then we have the Genestotoma, that is also not a liver fluke. Opisthochus, that is also a liver fluke. And the whipworm, which is also not a liver fluke. Then we have the fasciola hepatica, that is also the sheep liver fluke, while the cystosoma, that is the blood fluke. Katayama fever is seen in the cystosoma, hematobium, mansoni, japonica, or the mancogi. Yes, what is the answer? Katayama fever is associated with cystosoma mansoni. If you remember, Cystosoma mansoni that was residing in the inferior mesenteric vein and was having the lateral spine. And for all the Cystosoma, Cercaria was the infective form with the skin penetration as the mode of the transmission, and the egg was the non-operculated egg. Okay. Now moving to the Mansoni, that is clinical presentation with that of the swimmer's itch. Swimmer's itch, that was the type 1 type of hypersensitivity reaction. And then we had the Katayama fever. That was the type 3 type of the hypersensitivity reaction. Apart from that, the chronic cystosomiasis, as well as the secondary bacterial infection, as well as the secondary bacterial infection seen with that of the salmonella. So that was about cystosoma. And what was the drug of the choice? That was the praziquantel for all of the trematodes. But exception was there was the fasciola, where the drug of the choice is for the triclabendazole. Terminal spined eggs are seen in the Cystosoma hematobium, Cystosoma monsoni, Cystosoma japonica, or Clonorchis sinensis. Now, terminal in the hematobium, we are having what the terminal spines. In case of the Mansoni, that was the lateral spine. In case of the Japonica, that was the rudimentary spine. Apart from the rudimentary spine, apart from the Japonica, in which what else we have Cystosomia McCongi, and this hematobium, that is a terminal spine. Apart from the hematobium, that is the interculatum. Cystosoma interculatum also has the terminal spine. Moving to the next, Cystosomia japonicum resides in the vesicle plexus, splenic vein, systemic circulation, or the gallbladder. Yes, the Cystosomia japonica, that is residing where? Now, Cystosomia, we had Cystosomia hematobium. Where was it residing? That was the venous and the vesicle and pelvic venous plexus. And its radicals, that were the vesicles of the urinary bladder, that was also responsible for causing the this carcinoma for that of the urinary bladder, squamous cell carcinoma of the urinary bladder. Then we had the Cystosomia mansoni, that was the inferior mesenteric vein, and the Japonica, superior mesenteric vein, and its radical like the splenic vein. Man snail crabman cycle is seen in the Paragonimus westermani, Fasciola hepatica, Cystosomia mansoni, or Echinococcus granulosus. Yes. So man, snail, crab, man, cycle in the paragonimus that is also known as the lung fluke. What is the definitive host? The definitive host is the man. Then we have the first intermediate host that is the snail, and the second intermediate host that is the crab or the fish. Now, for that answer is the paragonimus. Then with the fasciola hepatica, in which the definitive host is man, the first intermediate host is also snail, but the second intermediate host is what? The aquatic plants. Cystosoma, we only have the two hosts. The first host, the definitive host is the man, and the second is the snail. Then we have the Kynococcus, where man is not the definitive host, man is accidental dead end host, where the dog is the definitive host, and man is an accidental intermediate host. Okay, now we'll do some questions from the Cestodes. Yes. So starting with the first question, Cysticercus cellulose is the larva for which of the following? That is the options are in front of you. Echinococcus granulosus, Taenia saginata, Taenia solium, or H. nana. Yes, what is the answer? Cysticercus cellulose. We have the Cysticercus as the larval stage for that of the tinea. Now we have two tinea. One is the tinea solium and the tinea saginata. For the solium, that is the Cysticercus cellulose, that is the larval form. Then we have the Cysticercus ovis for that of the saginata. Tinea solium, that is a Cysticercus cellulose, and for the Tinea saginata, that is a Cysticercus bovis, that is the larval form, and the Tinea solium, what is the other name? That is the pork tapeworm, and for the saginata, that is the beef tapeworm. Now moving next, man act as a definitive and intermediate host for the Tinea solium intestinalis or Saginata intestinalis or Saginata cysticercosis. Now for the normal intestinal teniasis, man is the definitive host while the pork is for the tinea solium and the cattle is for the saginata. But for cysticercosis or neocysticercosis, man is both the definitive host as well as the intermediate host. And cysticercosis is by the tinea solium, not by the saginata. Which of the following is the most common location of the intracranial cysticercosis? The pain, parenchyma, subarachnoid space, spinal cord, or the orbit? Okay, so which is the most common location? That is the brain parenchyma followed by the subarachnoid space. That is the most common location for the intracranial neurocysticercosis. Cysticercosis is caused by Tinea solium, saginata, and Calostoma mechanococcus granulosus, or the multilocularis. That is the easy one. The causative agent. The causative agent for cysticercosis is what the Tinea solium, and the humans are infected by eating what the uncooked pork meat containing what the cysticerci and cysticercus cellulose, that is the larval stage commonly found in that of the found in the pig. Which of the following is the most common central nervous system parasitic infection? That is echinococcus sphagnossus or the paragoniasis or the neurocysticercosis. So, which of the following is the most common central nervous system parasitic infection? That is the NCC, that is the neurocysticercosis. And what are the other helminths that are responsible involving the CNS? That is one is the Tinea solium causing the neurocysticercosis. Then we have the Tinea multiceps. Then we have the Echinococcus granulosus and the Gnathostoma spinigera. Consumption of the uncooked pork is likely to cause which of the following ailments? That is Saginata, solium, hydrated disease, or trichura. So it is by the consumption of the uncooked pork we are getting the tinea solium or the pork tapeworm, and by the eating the beef we get the tinea saginata, where the definitive host is what the man and the intermediate host is the pork or the cattle in beef in case of the tinea saginata. Now what is the drug of the choice? Although the drug of the choice is praziquantel for the cystodes, but for the hat, that is for the H for the high dated disease, that is for the Echinococcus as well as for the tinea. It is not the praziquantel, it is the second drug of choice, albendazole. Albendazole is the first drug of the choice. Now, moving to the next question. Cause of the epilepsy in up to 50% of the Indian patients is NCC, cerebral malaria, toxoplasma, or cerebral hydrated disease. Yes, what is the answer? Now, easy one, neurocysticercosis accounts for more than 50% of the adult onset epilepsy, and CT is used for to see the calcified cyst in the parenchyma, and for the extra parenchymal regions we are using the MRI. Skin test useful in the high dated disease, Cassoni test, Schick test, patch, or the Dick test. Yes, so what is the answer now? Cassoni test we are using for the high dated disease, that is for the echinococcus. On the one forearm, we are using the zero point 0.2 ml of the intradermal injection of the high dated fluid, and on the other, we are using control, that is a normal saline. And after 30 minutes as well as after 1 to 2 days, we check for the wheal and the flare response. But nowadays, not done because of the anaphylactic reaction, the sensitized people. Shick test we are doing for the Corynebacterium, diphtheria, and the patch test we are doing for the filariasis, as well as the Dix test we are doing for the streptococcus. All right. For the next question, ARC5 in CIEP is diagnostic for the high dated disease, cysticercosis, cryptococcus, or the brucella. Reason one, ARC5 in the CIP. What is CIP? That is the counter current electrophoresis. Counter-current electrophoresis that is used for detecting the antibody against the antigen, that is the ARC5 antigen in the echinococcus that we are using for the hydrated disease. We are using the ARC5 antigen by the CIP and the Western blot. It is specific to see for the B fragment antigen. Just remember, we are using the Western blot and the CIP for the diagnosis of the hydrated disease. Intermediate host for the hydrated is man, dog, cat, or the fox. Yes, that is an intermediate host for the hydrated disease. Now we have the definitive hydrated disease that is also known as the dog tapeworm or the hydrated worm. And what is the definitive host? The definitive host is the dog or the other canines like the fox. But intermediate host is what? The man. And man is actually an incidental dependent host. Man is an intermediate host. And he is an accidental host, that is the man. Hydrated disease of the liver is caused by the strongyloids, Echinococcus granulosus, Taenia solium, spiralis, or the Echinococcus multilocularis. Dog is not the intermediate host, dog is the definitive host. We have three examples where definitive host is not the man. One is the Echinococcus, another is the Toxoplasma gondii, where cat is the definitive host and man is an intermediate host, and one is the malaria, where the definitive host is the Plasmodium, this female Anopheles, and the intermediate host is the male. So these three examples, please remember. Hydrated of liver is caused by both the Echinococcus granulosus as well as the Echinococcus multilocularis. Multilocularis is responsible for the multiple locules, and it mimics M4M, that is mimicking the malignant condition, and it also metastasizes. Therefore, it appears as the malignant condition responsible for the multiple locular hydrated cyst. PAIR stands for the percutaneous aspiration, injection, and reaspiration, pervenous aspiration, injection, and reaspiration, or percutaneous aspiration, injection, and reaspiration. So we are using PAIR for where we are using the PAIR for the removal of the hydrated fluid and the cyst, and it is what is the full form? That is the percutaneous aspiration, injection, and the reaspiration. What is the drug of the choice for the Echinococcus? Albendazole, mebendazole, praziquantel, or thiabendazole? So drug of the choice is albendazole. We remembered for all of the cystodes, praziquantel is the drug of the choice, but exception is HAT, that is H for the high dated disease and T for the tinea, where the drug of the choice is not praziquantel, the drug of the choice is what the albendazole. Also for the trematodes, we just read the trematodes when we did the question. Drug of the choice is praziquantel, but one exception is the fasciola, where the drug of the choice is not praziquantel, it's and that was also the albendazole. Now the next question, true about the diphyllobathrum, that is a man is a single host, iron deficiency anemia is seen, opposite egg is diagnostic, or fish is the definitive host. True about the diphyllobathrum is for trematodes, it is praziquantel is a drug of the choice, but for the facial, it is a triclabendazole. True about the diphyllobathrum. Now, Diphyllobathrum latum, we remember it is such a huge name that it is the largest aphorm. Apart from this, it has three larval stage, L1, L2, L3, and it is having the two intermediate hosts. The first definitive host is the man, and the first intermediate host is what the cyclops, and the second one is what the fish. And it has three larval stage, L1, L2, L3, and the L3 is the infective form, that is the pleurocercoid, and the operculated egg is the diagnostic form, because although the cystodes having the non-operculated egg, but diphyllobathrum forms an exception. It has the operculated egg. Fish is not the definitive host. The man is the definitive host, and it is responsible for causing the megaloblastic anemia. And it has, how we remember, Diphyllobathrum latum, such a huge name that therefore it is the largest tape form. Other than this, it is the large various forms of the larva, that is the L1, L2, and the L3. And it is a large tape form, require the large host, many hosts, that is three hosts. Therefore, it will require, and it forms an exceptions because it doesn't have the non-operculated egg, it has the operculated egg. Also again large term is coming, therefore responsible for the megaloblastic anemia, not the iron deficiency anemia. That is why the hookworms. Second intermediate host in the Diphyllobathrum latum is the cyclops, man, snail, or the freshwater fish. So easy one, Diphyllobathrum, we have three hosts. One is a definitive host, that is the man, and the first intermediate host as well as second intermediate host. First intermediate host is what the cyclops, and the second intermediate host is what the fish. That is the freshwater fish. Dwarf tapeworm refers to Echinococcus lower H. nana or Cystosoma mansoni. Yes, dwarf tapeworm refers to what? From the name, that is H. nana means small. It is the smallest tapeworm, and it has only single host. That is one host is there, that is man. So that is a dwarf tapeworm is what the H. nana. All right, and H nana, that is the Hymolepsis nana. How do we get it? That is by the cysticercoid, that is the larval form. Which of the following egg contains three pairs of the hooklets and the polar filaments but is non-bile stain? H. nana, Solium saginata, granulosus, or the Diphyllopathrum latum? Now all the cystodes, they contain the eggshell, have the oncosphere, and that is the with the three pair of hooklets. All are with three pairs of the hooklets and are what? Bile stained. But H. nana, that is the smallest tapeworm with a single host, and it also contains the polar filaments, and it is what the non-bile stained. So three pairs of the hooklets will be present in all the cystodes, that is H. nana, Solium saginata, or the Cainococcus granulosus or the latum. But that is a non-bile stained. We are asking that is the kind. It is what the H. nana. Yes, so we are done with the class now. We have completed the questions of the trematodes, and later that we completed the questions of the trematodes, cystodes. And I'll see you in the next session. Please do use my code, that is Muskan 10, to get further 10% of the discount. Thanks for watching, and do like and subscribe. I'll see you soon in the next session. Take care and bye bye.